Reviewing InFORMed PICFs. About the InFORMed template. The InFORMed template has been developed to encourage researchers to think critically about what information should be included in their PICF and to work with consumers throughout the design process. This includes using effective language and visuals that work for potential research participants. It also encourages researchers to think about what does not need to be included in the PICF and suggests other ways information could be provided through layered consent. This reflects paragraph 3.1.25 of the National Statement. Although PICFs designed with the InFORMed template may look a little different to ones that you're used to reviewing, the template has been designed to comply with the National Statement and other relevant laws and guidelines. Working with consumers. A key principle for the InFORMed template is involving consumers in developing PICFs. This ensures that the information included in the PICF is relevant, easy to understand, and that the language is suitable for the intended audience. Ethics review bodies should ask researchers how they have included consumers' perspectives in developing the PICF. Plain language. The language and formatting used in the InFORMed template follows plain language principles. This includes using short sentences and paragraphs and avoiding or explaining any medical jargon. The InFORMed template also deliberately includes plenty of white space and at least a 12-point font. Ethics review bodies should ensure that these features have been retained. The content of the InFORMed template is deliberately flexible. We encourage researchers to add information specific to their research project and to change the template language to best meet the needs of their research participants. It is important for reviewers to check that any new text or formatting introduced into the PICF follows the same plain language principles. Visual aids. We encourage the use of visual aids in InFORMed template PICFs. These can be a useful tool to help the reader understand and remember complex ideas. Visual aids that could be used in a PICF include photos, diagrams, tables, and flowcharts. These aids should supplement rather than replace the text. Visuals should not be merely abstract or decorative. Ideally, researchers should work with consumers to make sure any visual aids are informative and easy to understand. Ethics review bodies should also check that there are captions or alternative text to describe any visual aids in writing. Layered consent. PICFs should focus on what potential participants need to know at the time of consent. What information do they need to make an informed decision? Researchers should work with consumers to decide what information needs to be in a PICF, as well as what information is best provided separately in supplementary information. This is known as layered consent. Researchers may provide supplementary information to potential participants in a separate study booklet, on a website, or through a list of additional resources. Every research project will be different when it comes to providing supplementary information, but examples include providing detailed study information, institutional privacy policies, or practical information for participants, such as where to park at a study site. The layered consent approach taken for the InFORMed template means there may be information that you're used to seeing in PICFs that is presented as supplementary information. In your review, consider whether this decision has been made in consultation with health consumers. Remember, the driving question for including information in the main body of the PICF is whether potential participants would consider it significant to make a decision to participate in the research project. Conclusion. As an ethics review body, you have an important role in ensuring that the PICFs developed using the InFORMed template are consumer-centred, use plain language principles, incorporate visual aids where appropriate, and focus on the most relevant information for deciding whether to participate in the research project. The InFORMed template should not be treated as a checklist. It is intended as a starting point for researchers and consumers to work together to create PICFs that are clear and concise for their intended audience.